This special edition of the Medical Minute is part of a collaboration with our friends over at EM Guidewire. EM Guidewire is an emergency medicine podcast based out of Carolina's Medical Center that strives to provide core concepts and cutting-edge educational resources for clinicians. This episode of the Medical Minute overlaps with our January case study as well as EM Guidewire's upcoming episode on SVC Syndrome. We will cap the month off with an unfiltered interview with Dr. Vivek Tyal of Carolina's Medical Center. If you enjoy Emergency Medical Minute, you will love EM Guidewire's high-quality, detailed podcasts on emergency medicine core concepts. Listen and subscribe to EM Guidewire on wherever you get your podcasts. Follow them on Instagram and Twitter, and check out their site at www.emguidewire.com.
This is the Emergency Medical Minute, sponsored by Health One.
All right, so I know it's hard, after that gripping sign out, it's hard to stay focused, but I actually have a pretty interesting case. So I was working at one of our facilities recently, and I had a young female come in, so she was a really good historian, and for about a week she had been waking up with a lot of swelling of her face, and didn't think too much of it. It wasn't painful. It kind of got better during the day. She thought maybe it was an allergic reaction. So she started taking some Benadryl. Then a day or two before she came in, it seemed like there was some extension to her arms and her neck, maybe with some pain or numbness in her arms or neck as well. She didn't have a history of a lot of allergies. She hadn't been exposed to anything new that she was aware of. And, it was just kind of bothersome and not going away. So after a week, she finally decided to come in. And on examination, her vitals were normal, but she did have some facial swelling. I mean, you could tell. So any thoughts? Did anybody have the diagnosis right off the bat? Because we actually did kind of figure out the diagnosis right off the bat when we examined her. So we thought it could be an allergic reaction, that her, thinking was not unreasonable, but we also thought about this syndrome that you hear about in your medical training, and then you never see it, so you forget about it, and it's called superior vena cava syndrome. So if you've got something compressing your superior vena cava, you'll get those types of symptoms. So in this patient, we ordered a CAT scan of the chest with IV contrast, and who's good at reading CAT scans? Anybody? Can you guys see this? Aaron is really good at reading CAT scans. So I'll point out some of the normals for you. You want to hold the microphone there? Some of the normals for you, because I know we don't look particularly at this view of the CAT scan. So liver, pretty normal. Bowel with air in it. The black is air. Stomach with who knows what, cheeseburgers in it. Air is black, so lungs are black there. That's fine. And then you've got the heart down here. You've got the aorta curving up here. And then the brightest white on this is going to be bone density and also contrast density. So there's contrast, which is coming down through the superior vena cava right here, and then just kind of stops. And then you can see all of this mass and all of this mass. And you can see a thin trickle of contrast getting down in the superior vena cava there. So unfortunately, this young, otherwise healthy female had a huge thymoma, a malignant tumor in her chest, sitting just above and wrapping around the heart and the left lung and the superior vena cava, that was causing near complete obstruction of her superior vena cava. So she ended up having a biopsy confirming it was a thymoma, and then eventually having a major surgery that included a sternotomy, resection of her left upper lobe, complete resection of her superior vena cava, and replacement with a Gore-Tex graft, and is doing well at this time. But typically when we see these, it's either going to be a lung cancer, a lymphoma, or a thymoma. They'll present with facial swelling, maybe arm swelling, maybe engorged neck veins, sometimes numbness or other neurologic symptoms. And so just kind of tuck away in your little bag of tricks that if you have a patient that does have facial swelling, it's not all allergic or skin or dental related. It can be from something in the chest that's obstructing the superior vena cava. And I have it up on the computer if you guys want to take a closer look at what I'm talking about.
We are on a quest to provide the world with free medical education. Please help us out by rating us on iTunes, following us on social media, and subscribing to our newsletter at emergencymedicalminute.com.